Good day, this is Professor Will, CBMD, PhD. Today's Friday, October 29, 2021. It is 1:04 and 33 seconds, p.m. Eastern Standard Time. Today's research, anti-malaria. So let's hop to it here. Promising new anti-malarial compound discovered. Date October 27, 2021. Source, McMaster University. A discovery opens the door to the development of new drugs targeting malaria, one of the deadliest infectious diseases on the planet. The researcher teams performed a screen of soil bacteria extracts for anti-malarias and identified an extremely potent inhibitor of malaria development. Researchers shined a new light. Drug resistance in malaria is becoming a huge problem, and climate change is pushing malaria, carrying mosquitoes, to new places, broadening the disease's spread. The World Health Organization estimates that malaria was responsible for more than 400,000 deaths and 229 million infections in 2019 alone. Researchers said that the family of compounds under study, drwillphd, have been known to kill malaria and cancer cells for some time. However, they are extremely toxic to humans. As such, using them as treatment comes with considerable collateral damage, which has resulted in many failed clinical trials. The researchers call these compounds anti-life, since they kill just about everything in their path. However, PDE-I2, the new compound molecule discovered by the McMaster Hamburg team, appears to come with all the potent malaria-killing properties of previously known drwillphd, just without the adverse effects. The researchers say the discovery is a decade in the making. Since then, the Wright Laboratory has been sending thousands of some fractions from Hamilton to Hamburg, where the research team would assay them against malaria parasites. It was years of trial and error before the researchers finally fractioned the right molecule, a process Wright likens to finding a needle in a haystack. And this novel compound represents a useful scaffold for anti-malaria therapy. And the researchers say they are excited to explore its efficiency in systematic infections and to pinpoint its mode of action. The main funding for the research study came from the Canadian Institutes for Health Research. And this is Professor Will, CBMD, PhD, on microbiology, bioinformatics, and pathophysiology. This video was created for educational purposes only. Hope you enjoyed listening. Until next time, have a great day.